Good morning, everyone. My name is Lolly Gardner. I am the current education chair for the ABSA committee here. I have a pleasure of welcoming David Gillum. Good morning, David. I see you on there. David Gillum is the Senior Director of Environmental Health and Safety at Arizona State University. He directs a team that provides professional and technical support to more than 2,400 laboratorians, art studios, shops, and other areas using biological agents, chemicals, lasers, radioisotopes, X-ray devices, and other hazardous materials and equipment. David is also the responsible official for the Federal Biological Select Agent and Toxin Program. David is the current 2020 president of the American Biological Safety Association International and has been an active member of the safety community for over 25 years. David received his bachelor's degree from the University of Nevada, Las Vegas in 1997 and his master's degree from the University of Massachusetts, Amherst in 2000. In 2011, David co-founded the Arizona Biosafety Alliance, an ABSA affiliate, and served as president, past president, and treasurer of the organization. In 2015, David established a partnership with ASU in Mexico and MX Bio to support biosafety collaborations within Mexico and other Central and South American countries. David has presented at several Amex Bio conferences and welcomes future collaboration with international partners. David's service also includes contributions as the associate editor of Applied Biosafety, Journal of ABSA International. His academic interests include the future of synthetic biology, gene editing and gene drives, and how members of the public can have an active voice in the future of these technologies. He has authored and presented at dozens of conferences regarding these emergency technologies and has written several articles for the ABSA Journal, including 2 evaluating the value of biosafety professionals, as well as articles regarding biosecurity, personal suitability programs, and the Arizona Biosecurity Workshop. Thank you for being here, David, and you've got the camera now.
Thank you so much, Lolly. That was a lot. Man, 2020 has been quite a year, huh? So I am trying to share my screen. Is it working? No, it's not.
No, we are not sharing yet, but just share at the top. There's a share button at the top.
I see the share button. Okay, hold on. I sent you guys the presentation. Is anybody able to load it?
I can probably load it.
Thank you.
Problem is, if I load it, Dave, then you can't flip the slides.
Is it okay if I just ask you to go to the next one?
Yes.
Thank you very much. I'm sorry about that.
Hang on just a second. I got to switch roles here.
All right. Well, good morning to everybody. While we're waiting, and 2020 really has been a heck of a year. What a year to be ABSA president. I feel like I'm so disconnected from you, but yet I feel like we're doing so much at the same time. A few of the things that I'll just briefly mention, Lolly introduced me, but we're actually, I've published three papers this year. The third one that I just got accepted into Applied Biosafety is another kind of a salary survey internationally and domestically. And I think people will be really interested in seeing that paper as soon as it's published. So just be on the lookout for that. We hope it's out in the next few weeks. And today I'm going to actually talk about 3 different subjects. I'm going to give you an ABSA update, what we have been doing this year. I am going to give you a little bit of information. There we go. I was going to call it ABSA, ASU, COVID, and you, but I just decided to call it for ABSA. So welcome everybody. Could you go to the next slide, please?
I can, as soon as I remember how to do that.
All right. Well, thank you very much. So as I was mentioning, this is a 3-parter. I'll try to get through it as quickly as possible, but hopefully it's interesting to you, and I don't bore you with details of things that you may have already done yourself. So first is the ABSA update, and then I'm going to give a brief overview about pandemics, and I'm calling it the good, the bad, and the ugly. And a little bit of the main part of that is that there may be a few good takeaways. And then the third thing is how we went from having our first COVID case on January 26th here in Arizona to closing and then reopening, and how we did that. So the next slide, please. All right, President's update. Next slide, please. All right, well, some good news. So ABSA is doing fairly well. We've got over 1,500 members, 127 international members from 37 different countries. We have over 430 credentialed biosafety professionals. For those of you on the call, you're part of a biosafety organization, so I'm not going to go over the purpose. Most of you are actually ABSA members, so I'm just going to skip that part. I will say that at this year's conference, we are expecting a lot more international participants, and I'll explain that in just a moment. The next slide. So as everybody knows, the conference this year is going to be virtual. I'm obviously very disappointed because I wanted you guys all to be here in Phoenix and we were going to have a lot of fun. But unfortunately, that's just not the way it worked out this year. But everything in the conference will be recorded, and the good news is that you can get group discounts and it's going to cost less than what the in-person cost would be. So hopefully everybody knows that and you have a chance to go in and register. Okay, next slide, please. Also, today's October 1st, so I wanted to highlight that this is Biosafety Month, so International Biosafety Month. And the topic for this year is very timely. It's the role of biosafety and biosecurity in mitigating emerging risks. I'm going to highlight a lot of the areas in my third presentation about what we've done here at ASU and how it really, although no one group or person could have done the work, biosafety team has been amazing. And I'm going to talk about that in more detail. So really, how have your roles shifted as a result of the pandemic? I'll tell you mine completely shifted. It's been COVID. What roles have biosafety professionals filled? Some of you, we'll talk about that actually a little bit, have taken on other roles. And how can we support biosafety professionals during this kind of crisis? How can we actually provide information that's useful to them to help them better respond to emerging risks? And how can we continue to fulfill our normal functions while working virtually? The next slide. So again, I mentioned this is an all-online conference. You can register at that link. And we have over 12 professional development webinars, 3 days of scientific programs. And believe it or not, the posters and exhibits will all be through a program called Lab Roots. Okay, next slide, please. Right, this year we have some good news. We're switching to Marianne Liebert instead of Sage. Sage was fine, but Marianne Liebert is a smaller organization that's kind of a better fit for ABSA. So I encourage you all to submit your papers if you have good papers to write about. Everybody who's presenting during your conference probably should work on writing a paper if they haven't already and submit it to the journal. You get really good publicity through there. You really help get the information out to people who really need to hear it. So there's that. Please continue to submit papers. This year, this is the first year, it's 2020, believe it or not, it's the first year we're going to have an award created to honor a woman. And so we're honoring Diane Fleming. This is really important to me personally. So I have 4 sisters. I've seen all of them hit the glass ceiling and just not be recognized as much as male counterparts. And I'm just so thrilled to be able to have this award created. Diane was really an amazing person. Being the first openly gay president of ABSA is also a reason I care about diversity and inclusion. So really, it's not just, she was an amazing woman. She is an amazing woman. I've talked to Diane recently. She was looking forward to actually potentially coming to Phoenix this year, but instead she's looking at coming next year to Raleigh. So Diane was amazing, is amazing. She was a 1989 past president. She wrote Biological Safety Principles and Practices. She inspired many people to become biosafety professionals. And this is really, it's the criteria for the specifics on how to get the award are still being created. It's open to men and women. It's not just for women, but it's for everybody. And it's to recognize excellence in education, mentoring, and training. Next slide, please. One of the most active groups as part of ABSA has been the Emerging Infectious Diseases Committee. And they've been truly knocking it out of the park since March. They have so many resources on that website. It's become a huge, I don't want to say bestseller, but it's definitely like one of the most clicked on links within ABSA. So just kudos to Esmeralda Meyer and Marion Downing for co-chairing that committee and just knocking it out of the park. Truly amazing job. Next slide, please. So news just broke. The USDA ARS Symposium is going to be virtual this year. I'm not sure that's a very big surprise to everybody considering how much everybody's doing virtual this year. But if you're interested, you'll be able to participate virtually at the 2021 USDA Symposium. Next slide. And then right now we're on the fence trying to figure out whether or not we're going to do the Biosecurity Symposium online and virtually or not. I'm kind of hoping for a hybrid. I'm getting a little stir crazy not traveling, so that's my own personal preference, but we will see what happens. Next slide, please. Okay, and just wanted to throw in a few photos of ABSA showing that it's cool. It's a cool place to be. So. All right, I'm going to talk now about pandemics. So, I mean, everybody knows we're in the middle of it, so this shouldn't come as a surprise. Actually, let me see, I can't see the left here. I've just put in a few resources for folks. So, pandemics have been going on for quite some time. They impact a lot of people. It killed a lot of people, and this is just one example from a scientific journal about the different pandemics that have been out there. There's others. I'm going to show you a couple other examples in just a moment. But the point being that we are dealing with SARS-CoV-2 and COVID, and it's killed, I think, over is it over 100,000 in the United States? I need to check my math. It's something that when you're in the middle of responding and doing everything we're doing, you kind of lose track of some of the numbers. But it is amazing. So it's impacted the entire world, as all of us know. So the next slide, please. Some of you may have seen this slide. It's a nice graphic. It's actually from a website called Virtual Capitalists, which is very interesting to me, but totally irrelevant to this conversation. But it really is just a nice graphic to show which pandemics had the most impact on the country, on the world, and how many people died from it. Obviously, it goes all the way back in time to the Athens plague, the plague of Athens. But I'm sure there are other historical accounts that kind of go further back. Definitely devastating lots of people, as you can see. Next slide. And this is another graphic from the Washington Post back in April 2020, trying to demonstrate just how bad things can really be from pandemics, and just to make sure we always keep our eyes open to the potential that something bad can happen. And all of us know that working in biosafety, that there's potential risks. For example, doing research at all has a risk, and working with agents that are pandemic pathogens is also a huge risk. So just more graphics to just reiterate, this isn't the first, probably not going to be the last. Okay, the next one. And I really like this this article. If you're interested in reading about it, it's called Pandemic COVID-19 Joins History's Pandemic Legion. It has a nice overview of all the different pandemics that have occurred, and talks about how they relate to each other. So over time, as population increases, obviously you're going to have, if you have a pandemic, it's going to impact more people due to density alone, globalization, and things like that. Next slide, please. And I always I'm sure all of you know these resources, but the New York Times has a really amazing tracker. All of us are probably watching our own institutions, our own city, our own state, but it's good to take a step back and look at it from a really broad perspective and see what's happening. So as you can see, I was pretty close. This was back on Monday. I think I did this graphic for you. Nearly 1 million deaths around the world, 33 million plus cases. And in the United States, it's like at 200,000. So I was pretty far off on my guess there. So, but it's a really good graphic in case you guys haven't checked it out. And it's updated like every day, and it's free so that you can access it. And actually, one of the things I just want to mention is Esmeralda Meyer reached out to all of the news agencies. She sent out a massive email to all the news agencies on behalf of ABSA requesting that they make all coronavirus resources articles free, and so they did. So it's amazing. So kudos to Esmeralda and ABSA for kind of pushing that through. Next slide, please. This is just a little bit of the current snapshot in time of where all the hot spots are. You can tell that South America is being hit pretty hard. Africa and Asia not as much anymore. Part of that could be due to testing and not knowing, but definitely South America is really a hot spot right now, and obviously the United States. Next slide, please. Here's another graphic showing a snapshot in time. So the Midwest is kind of being hit pretty hard right now. Looks like Colorado, some of you might be in that little red dot right there. Thank goodness for me, Arizona is really seeing a decrease. Definitely we're noticing it, and I'll talk about that briefly when we talk about our testing. But we're seeing less people actually coming in to be tested, which is a little bit bad for us as well, because we want to continue to make sure that everybody's getting tested so we know what's actually happening. Next slide. As all of you probably remember, trying at the early stages, trying to figure out how infectious this is. This is from the New York Times. It was an article just trying to gauge where coronavirus was in terms of its R naught and how infectious it is. So this is early. And next slide, please. And I just, I'm sharing this to kind of, everybody probably knows this on the call, but you can tell like measles is obviously much more contagious, but this is a good resource to show. I think that over time we're going to find that the R naught is going to show us, it's going to be a little bit more accurate. You can actually see there's a range on it. So I'm not going to get into the details of this. I think most people on the call understand it, but this could be a whole discussion in itself. A little bit of background before I tell you why I'm really telling you all of this. So the next slide, please. So this is really what I wanted to get to with this short little talk, is that right now, it's hard to think about anything positive related to COVID. I mean, so many sick people are dying. We have, it's become politicized. We all have to wear our masks and our face covers. Sorry, talking to safety people, I got to get that right. And so like, it's hard to think through like, what's the good? Is there any good? What can we learn from this? And so one of the things from this paper by Lee Clark about called Worst Cases, Terror and Catastrophe in the Popular Imagination, another good book if you have access to it. He says a few things. We can use disaster to study important things about how and why people think and behave as they do, especially in a crisis. Then the next one is we see that disasters provide occasion for the creation of heroes. Ordinary people who, as a result of catastrophe, find themselves taking actions that others regard as extraordinarily unselfish and brave. And I'll tell you, like, just talking about our biosafety team, for example, here at ASU, they've become the testing expert and leading all of our testing activities here at ASU. They've been deeply involved in the creation of standard operating procedures. They've gone and they work 7 days a week, 9 to 5. We offer testing at all 4 of our campuses, 7 days a week, 9 to 5. 2 days a week, they're open late from 11 to 7 at the different campuses to allow students and employees to be able to do a test whenever they want. And I absolutely believe that is the reason we are still open and we're being as successful as we are here at the university. So just these individuals have become heroes. We've had a project manager who has had no experience in biosafety also join us, and his world has changed. He's totally changed. He used to like manage a project through start to finish and help you have information to kind of keep it on track, and now he leads our downtown site. Just amazing. And the amount of recognition and kudos and thanks for these people who just took on these tasks has been huge. So totally amazing. Disaster can lead to better social betterment overall. Let's hope long term we're going to have some really great some betterment in society, maybe less politics and more caring for each other, to have a greater good for society. And this one's it's sometimes I think about these things. Catastrophes provide a stimulus for stretching the imagination. Now, does this mean we should all run out and have catastrophes every day? I definitely don't think so. I think that would be totally crazy and we'd all go insane. But I think that they do give you an opportunity to try to think differently, to come together to solve a problem. So that's what I wanted to say there. Next slide, please. And again, a few more, I call it silver linings because I didn't know what else to say. It's hard to think of anything good when there's so much bad. But so while we should not forget or ignore the human suffering of COVID, this pandemic has provided us with opportunities to advance scientific and technical knowledge. Just think of all of the research that's taking place with COVID alone and how quickly they're creating vaccines. They're developing new ways to test for it. If you did a nasal pharyngeal swab at the early days, you know how awful that was. It makes you cry, you want to die, and then you can nowadays use saliva testing, and soon you're going to have even more rapid detection. So just the amount of scientific knowledge and expertise that's just we're learning about, it's amazing. People have come together to think of innovative ways to reduce the spread. I talked about the less invasive testing system and ultimately create a vaccine. And just even early on, we have our sustainability folks and our do-it-yourselfers kind of coming together to create homemade 3D printed face shields. They were looking at everything. Homemade respirators, trying to do those, homemade safety glasses. Not that it meets necessarily the ANSI standards, but when you're in a crisis and you can't get any personal protective equipment, it's just huge to have that flexibility to be able to create these things. And as Winston Churchill said, never let a good crisis go to waste. So I wanted to try to be positive and find some good and give you guys some hope instead of everybody thinking this is never going to end and we're all gonna just never get back to any kind of normal. But hopefully we will. Okay, the third thing I wanted to talk about today, and hopefully this isn't too boring for you folks who've been through this, but I kind of want to highlight a few of the activities that we did through at ASU to how we actually stayed open. I have had, I think, 2 vacation days this year, the entire year. I'm going to lose a lot at the end of the year because I have been at work almost every single day. Well, not weekends, so at least not now. Okay, so next slide, please. So this were the early days. Back in January, I was super happy. My dog just loved me to death. Just everything was peachy and lovely and just amazing. And this was back in January. Next slide, please. I was recently promoted. I became the 2020 president. I had some champagne. Everything was just amazing. Life was great. I got a new painting behind me. I was just super happy. Nothing could possibly go wrong. Next slide. But then everything went wrong. So back in January 9th, obviously you're going to remember all this, but the World Health Organization announced serious coronavirus-related pneumonia in Wuhan. And this was just one of the tipping points for when people started to actually react. There were people who were watching it in China before that, but this is something that was definitely one of the things that I saw. Yes. Sorry, checking my text. I shouldn't do that when I'm talking. So this is one of the things that I recognized when I read about it. I thought, what are we doing at ASU to make sure that if this mysterious thing, if it actually spreads, what are we doing? What do we need to pay attention to? How serious is it? So let's go to the next slide. And then on January 20th, our department really began heavy conversations with our ASU Health Services regarding this virus. So we were thinking about it, but we weren't really. I think it was just on our radar. And when we saw this article in Stat News, it's actually circulated in other newspapers as well. But it's talking about how cases were spreading among healthcare workers in China. And it said that a Chinese health official said today that 14 healthcare workers were infected, bolstering evidence of human-to-human spread. So this really started to kick off some alarm bells, and we were immediately reaching out to health services to say, what's going on? What are your sources saying? What's happening? Next slide. Same day, we realized that we checked with CDC, checked with WHO, and saw what other people were talking about. And we started to put up signage in our health services about people who had traveled to Wuhan. And we put it up in multiple languages to encourage people to put on a face cover. At the bottom, you can see we requested that patients wear a mask. At the time, we were still calling it a mask. And notify nurse triage with any concerns in case the patient may need to be evaluated and possibly isolated. So this was January 20th. Still pretty early in the crisis. I'm sure other people did similar things, but next slide, please. There was a lot of things that happened really fast, and so that's why I'm kind of showing you the early days of what we did. CDC said that the first travel-related case of COVID was detected in the United States on January 21. Our Maricopa County Department of Public Health issued our first guidance document for healthcare workers, and I think I have that on the next slide. So next slide, please. I don't, but that's okay. The 21st, also, our brains were spinning. We're thinking, oh my goodness, what's going to happen? Are we ready? How bad is this going to get? And so we began inventorying on January 21st, all of our N95 respirators, surgical masks, nitrile gloves, gap wraps, everything in our pandemic inventory. And this graphic on the right actually shows all of the things that we had. It's one column, it's not everything, but it shows things that we had in stock in our pandemic storage supply. We started our pandemic committee back after SARS, and we, over the years, have been building up the inventory in that space. And as anybody who manages an inventory knows that things tend to go bad over time, especially in the desert. We have gloves that were starting to dry. So we had to develop, about 5-6 years ago, we developed a rotation system where we would rotate out some PPE before it expired, and we would work with our animal care programs and other people facilities to get them PPE and then resupply our pandemic storage. So something to think about as you're going forward, especially if you didn't have one, or if you had a small pandemic storage, you want to think about how you can have a warehouse for a future pandemic. On this same day, all January 21st, so the one this week was, like I said, crazy, we began to have conversations with our Emerging Infectious Diseases Committee, which I am a co-chair, and that one used to be called the Pandemic Committee, but now it's the Emerging Infectious Diseases Committee. And we just started thinking through, what do we need to do as an institution? Next slide. The next day, our department began really becoming a resource for everything COVID and starting to circulate it among our committee, as well as the senior leadership really started taking an interest in this. And that should have said that we started asking people who are sick to stay home, not who are sticks. That's kind of funny. Okay, next slide, please. The 23rd, senior leadership really began asking if we have ever looked at whether we have any ASU community members that have been traveling to Wuhan. So we started reaching out to our International Scholars Program, folks who were from China specifically at the time, in Wuhan, international students and that sort of thing. And especially since this was after Christmas break, the winter holidays, people were just starting, they came back, the school started January 15th or something, 16th, around that time. So really, if people had just come back from China, they potentially could have been infected and then bringing it back to the university, which everybody knows kind of that's sort of what happened around the world. And then we started on the same day discussing restrictions, university travel restrictions. Next slide, please. Then the 24th happened. So like I told you, this week was absolutely insane. Like everything was pushed into high gear. We actually had a tabletop exercise on a Friday. We pulled the entire committee together. We brought together, all of our potential emergency operations center personnel to talk through this scenario. And it was a suspect case on campus. A 20-year-old student self-reported to health services with flu-like symptoms and fever, reported travel within Wuhan boundary within past 14 days and reported past exposure. So this was our like we were thinking this will never, like maybe it won't happen for months, but we were just thinking, let's start to think through what we can actually do. We had lots of information presented at the committee about the CDC updates and State Department updates, things like that. How do we prepare for this emergence, for any bad press that would come? Media relations was there. Again, our study abroad folks were there. Like it was a good meeting, but all of it, and we had lunch. It was still pretty nice. The world was still seemed pretty decent at that point. But then, next slide, please. 2 days later, we had something happen in Arizona that was the 5th person in the United States to be infected. It was very similar to our scenario. So I guess in some ways it was good that we prepared, but we immediately opened our emergency operations center. We co-located our emergency manager within the Maricopa County Public Health Operations Center, and she stayed there for 8 days. Fortunately, this individual never transmitted it to anybody else, their roommate or anybody else. So we were very, very, very lucky. But it kind of gave us, it was a shot in the, not in the arm, there's a saying about that, a shot across the bow, so that we actually were we were ready. We were starting to get ready. Next slide, please. Then, just imagine, I started this conversation 1 week earlier. We activated our emergency call center. We have a main line that deals with hundreds, if not thousands, of calls a day, and we started giving them information to talk about COVID. We had our coronavirus webpage open, and I tried to get a snapshot of it back in the early days because it's changed quite a bit. And we immediately updated all of our essential personnel lists. Next slide, please. The 28th, again, still about a week had passed. Our president requests that we, EHS, distribute hand sanitizer and surgical masks across the campus. We started putting them in. Mostly we started doing this in the student health services. We put in the surgical masks there so that we wouldn't run out. We did have over 100,000 surgical masks, believe it or not, because of our pandemic storage. But we were trying to ration them because we were worried that they were going to run out, and they got really close at one point. And then we also put hand sanitizing stations in every single entrance to every single building, and sometimes in the dorms on every single floor. We quickly, though, the vendors and distributors started to sell out, and it was almost impossible to get some. So that was fun. At the time we purchased 26,000 4-ounce hand sanitizer bottles as well, because there was an idea that we wanted to have every student have a bottle to start. Granted, that's not very sustainable, and being trying to be a really great sustainable university, COVID has definitely challenged that. I'm sure all of you know that. The amount of waste that we create has just been a bit intense. At the same time, on January 28th, EHS issued a new document called Surface Decontamination Procedures for Coronavirus and Other Respiratory Viruses. So we were really, really moving fast. Next slide. Here are some of the bottles. You can see they came in large packs, and we had people coming up to our building in cars, and we were having appointments where we were handing them out. So we were handing them out to everyone across the campus. I think some of this I just said. I'm sorry, there's a little bit of duplication. And then the 29th, we had travel to China being banned. Next slide, please. Okay, that was the first week. No problem, right? Next slide, please. So I'm going to kind of break this down a little bit faster now. On January 30th, we still had classes on regular schedule, although the World Health Organization announced that it was an emergency of international concern. On February 2nd, we began working with our vendor to implement 1 time per day disinfection wiping of all high-touch surfaces. It wasn't something that was done every single day. It was done every few days. And, we had to start negotiating with our contractor to make sure that they actually had their supplies filled as well. Then we had, again, the Emerging Infectious Diseases Committee started to meet every single day. We did an update every day for weeks. Then we had our second COVID exercise I think after the first one, we were all hoping that we wouldn't be spot on and we would never have to do these again. But we had our second exercise about quarantine and housing on the same day, February 6th. There was some bias happening and people were starting to accuse people from China. There were some pretty nasty comments being made, and but the university started issuing letters saying that this is an international issue, this is not a Chinese issue. So there was definitely a lot of emotions at play at the time. Next slide. So this is when our president issued his letter on community values, expressing that we are a community, we support each other, we value each other, and just that we may be in this for the long haul and start thinking about how we can be resilient. Then we had a week later, the 14th, we had our third tabletop exercise on public and sporting events and the possibility that they would be canceled. Shocking. They were eventually, and we're still dealing with that. Then we had an official COVID statement from Maricopa County on the 21st. We then, on the 27th, started our study abroad program was deferred. We stopped sending people internationally on study abroad programs, and we had our Joint Information Center established with Arizona Department of Health Services, Maricopa County, and ASU. And this was expanded beyond what the initial 8-day event. We updated our website on February 28th. The March 2nd, we hosted, believe it or not, our EHS teams all came together on March 2nd to talk about a lot of other things related to safety. We in Northern Arizona University and University of Arizona, we always like to get together and talk about what's going on, what do we need to be concerned about. And I would argue that COVID kind of took a minor role in that. We all thought it wasn't going to happen. Everything was happening right around the world, but all of us thought, well, it's hot in Arizona, it'll kill the virus. That's not exactly what we thought, but people were saying things like that in the news. So there was a lot of speculation still. March 2nd, we began to notify remote versus on-site personnel, just saying you may be asked to work from home. On the 2nd, we posted signage in all high-traffic areas, restrooms, and dining areas. We created entirely new signage related to COVID, and we have tons and tons and tons of signage. So I think the sign industry has probably done very well from all of this. Also, the disinfectant vendors and everybody who does those sorts of things has done well, and toilet paper manufacturers. March 3rd, we had our second, so a whole month went by. Then we had our second positive case in Maricopa County. We started implementing international travel restrictions, and if someone was sick, we asked people to be self-isolate. We had business interruption and insurance language change for cancellations and things. All of our supplies related to PPE, disinfection, et cetera, were centralized and no longer just our pandemic storage. We actually did calls to laboratories to see if they would share their personal protective equipment, and we got amazing responses from that. People gave us literally tons of personal protective equipment. And then we had updated travel restrictions again on the 6th that discussed where you should not go, which was still Asia and things. Then on March 7th, it was the week of my birthday. I had an amazing trip planned. I was going to Mexico. I hate technology because I was on the plane, and you know how on the plane you can still get texts nowadays. I got a text from my boss saying that I had to come back. So I was probably crazy to think I should even go to Mexico, but my birthday is pretty important. So, and also it wasn't a restriction to go to Mexico. But I got to Leon, Mexico, turned around, went to the bar, had a margarita, and came home. That was a really crappy birthday. I probably shouldn't say that on the webinar, but anyway, maybe you can beep it out. Just kidding. Okay, on March 8th and 9th, so again, we started having these drive-throughs where people, you can see in these boxes, we make kits for the campus community. We had all of these supplies available for ordering through our Workday system. We developed enhanced cleaning protocols and implemented them on shuttles. We also started blocking off seats and things like that. Again, on March 9th, we started creating different kinds of COVID safety kits. So we had personal ones, we had lab ones, we had post exposure kits and things like that. At the same time, so I told you I was promoted back in November. We were also in the middle of a reorganization of our department, and that all was happening all at the same time. So again, never let a good crisis go to waste. Next slide. March 11th, World Health Organization declares a global pandemic. Same day, ASU, or Arizona, announces a state of emergency. We immediately transitioned every in-person class to online instruction. Travel guidelines then on the 13th were updated. People really couldn't go anywhere anymore. We increased cleaning and housing to 4 times a day for all high-touch surfaces. And on the same day, Pac-12 canceled all sports for the remainder of the year. So lots of things happened in March. 14th, we started implementing a laptop distribution program. This cost millions of dollars, and but we didn't have ways. Some people have old desktops that they couldn't take home, so we had to distribute to employees and students who may not have had the resources to continue their instruction or to work. The governor on March 15th closed all schools. Our online classes were then extended. We didn't know at first how long they would be online, but they were. Teleworking obviously was established. We then started helping all of our laboratories go into a hibernation mode. We implemented self-screening health checks at every single building before you could go in if you were going to work. And that involved a person sitting there reading questions. And I'm sure, here it is right here actually, these questions that said, do you feel sick? Do you have a fever? Have you had any known close contact with people exposed, et cetera? And at the time, it wasn't a mandatory app like we have now, but it was just a way to try to encourage people to stay home. Many people in the old days, pre-COVID, would come in with a slight fever or cough and be like, oh, I'm fine, I'm not contagious. Well, not anymore. Then we had all ASU offices in California closed. So we have offices in DC and California. We had our first COVID death in Arizona on March 21st. Then we started seeing the New York City travelers restriction and the 14-day isolation. And then we had the Arizona governor issue his COVID-19 order for people to start to stay home and wear masks. Again, April happened. We started transitioning everything a little bit further down the road to more remote. And April 7th, the CDC issued the cloth face coverings memo or letter. Next slide. We, same day, implemented a COVID-19 safety training for on-site personnel. It started out as voluntary because people weren't actually coming in, but then it eventually became mandatory. Next slide. This was part of the training, and it was something that my boss, she wrote, and she said the health of the Sun Devil community is a top priority. Thank you for doing your part. And it was just a nice way to try to show that we really do care. And this training, here you can see kind of what the purpose was. I'm sure many of you actually implemented it, similar things. At the bottom, you can see some of the graphics and the signage that were created as part of this campaign. And we had over 3,000 people take it at the end of the end of April, early June. And since we've implemented, we've had over 18,000 people take that training. On April 30th, we started talking about summer, what we're going to do for the fall. And on June 2nd, we made it mandatory June 12th, we made it mandatory for face coverings on campus, which was probably one of the major things that helped stop spread on campus. Next slide. Getting into the end of July and early August, we had the fall reopening plans posted to our website. We implemented the requirements for how you could actually start to come to campus. On August 11th, we required a daily health check through an app. And this is you have to do this check before you can actually come to campus. Next slide, please. Again, it really was trying to communicate to people who are sick, please do not come in. Although the crisis does make a hero, please don't be a hero and stay home and do your job from home if you can. And now we're getting into the present and almost end of the slides. We have an entirely new COVID testing phase underway. We have randomized testing. 1% of all employees are tested per day. 2% of all students are tested per day. So that's randomly selected, and you can also go do it for yourself if you want, but you may also still be randomly selected. We have shifted our operations in our housing facilities. We have dorms that are for COVID positive individuals. It's been quite a crazy time, but we are still open. And then we started creating a registration process for guidelines for in-person and meetings. We have a committee that approves every single event of any size on campus using ASU resources. And now the present. So what is the present? It's COVID. Testing. Everything is basically testing. My world is, although it's starting to come back to normal, people can get a saliva test. This number is actually wrong. The time is actually now between 12 and 24 hours for results. And if people have concerns, they're not asked. So we have asymptomatic testing sites inside our buildings and symptomatic or asymptomatic testing sites at our outdoor parking facilities that we run 3 days a week for the symptomatic and every single day for asymptomatic. Next slide. This is kind of what it looks like. This is one of our very first conference rooms in my building that I'm in. We set up a large conference room, went to IKEA and bought out everything they had in terms of their shower or racks for clothing. And we bought plastic and we set up homemade MASH style testing facilities. Next slide. Then we at ASU is big. We have to do things big. This is one of our old gyms that was eventually going to be renovated or torn down and something new built, and we converted it into a 75-station testing facility, saliva testing facility. And you can see the folks there doing some of the work. Next slide. And these are all of the different, so the fellow on the bottom left is our project manager, Curtis. He took over the downtown site. On the top left are Amanda Rice and Irene Mendoza, who really have been, Amanda is our overall site testing manager, and Irene is our safety compliance person for everything COVID related, especially the testing sites. Giorgio Scarpolini is in the middle. He's one of our biosafety officers here, and he is at our poly site. Again, me and Irene. And then on our bottom right, we have an EMS program. All of our EMTs that work for environmental health and safety all now are dedicated 100% to COVID testing. So we also implemented a pay raise for them since they are working in a hazardous environment. And we have about 25 EMS that now do that, dedicated to COVID testing. If anybody wants more information about anything I talked about, here's a bunch of resources for you. And then next slide. Again, I have to put this disclaimer in there, but when we did this, everything was based on CDC best practices. The funniest part of that is that CDC changes their guidance like almost every day. Hopefully it's based on scientific evidence and not politics, but who knows? So anyway, this was our disclaimer at the time, and it's also a document that we shared freely among the entire world if people wanted to use it. Next slide. I think that's it.
That was the last slide.
Yeah, that's it. That's my show. Hopefully I entertained you. Or I put you to sleep, one or the other.
Thank you, David. That's a lot that happened in a short amount of time. I see we have a couple questions if you're up for taking some.
Sure.
Okay. From Madeline, it says, what with the fingers in the slide? Oh, your fingers, you know, what you were doing?
Oh, this?
Yeah.
This is Go Sun Devils. This is our what do you call it? Like at football games, you do this, you go, yeah, go ASU.
Yeah, being a wildcat, yeah, we don't like those.
I did it on purpose. Come on, you guys.
Thank you. From Anthony Wang, what was your positive rate for the test done? Was it the procedure what was the procedure when a positive case was identified?
Well, it has evolved over time, and our positivity has, done like a bell curve and it's starting to come back down. There were times when our housing population was like 25% of people tested. It was crazy. But granted, we weren't testing a huge number of people. And then it dropped down very quickly after that when we started getting more people. And you have to think, like most of the people early on were voluntarily doing the testing. So people who were sick were going. So that's how we were actually capturing that. The second part of that question, could you repeat that slowly? Sorry.
Yeah. Yes, it's what was the procedure when a positive case was identified?
Yep. So early on, we were doing things where everyone who turned up positive, they actually were just told to self-isolate. So many people were starting to be positive. It was overwhelming the healthcare system, and then we started switching to telemedicine and things like that. So people were asked to self-isolate. Granted, one of the things we'll probably learn is that we aren't like China and other places that would like lock you into a room and feed you and stuff. We relied on people doing the right thing, and mostly they were sick, so they wanted to stay in. As we moved on and we implemented contact tracing, contact tracing was a nightmare because we started with just like 1 or 2 people doing contact tracing, and now we have many armies of people doing contact tracing because it is so time intensive. And I have to say it's really funny though. Nowadays, there are students who don't want to get tested because they don't want to leave. They don't want to not spend time with their colleagues, their friends. They don't want to be stuck in a room. And if they do test positive, they don't want to tell people who they've been around because they don't want their friends stuck in a room.
Sure.
It'll be an interesting psychological assessment at the end of all of this. Like, why do we do what we do and things like that. So, anyway, hopefully.
Another question from Mike Burt. When you transition to off-campus or homework versus office, how much pushback did you get, and what was it like in the beginning versus now at your university?
Well, I think that in the beginning, so this is Arizona, we're a right-to-work state, and I think any place that's a right-to-work state means that, you can be fired for any reason. Not that that is an incentive for people to work, but a lot of people do go into work because they're worried, like, it's an American mentality that you have to work. We're very driven as a society, and people thought, well, if I don't go to work, I'm going to lose my job, or I'm going to be seen as not needed. Fortunately, ASU has not fired anybody. Our president has made a commitment not to fire anybody. Obviously, there was also the laws that protected people early on. And from our perspective, I would say that many people were nervous about working remotely. We were a department where everybody was coming in almost every single day. Now, granted, we're not totally representative of the whole university, but I'm talking about us specifically in EHS. But over time, now people want to work from home. They don't want to come to work. Now it's like I have to give them a carrot, and to try to get them to come back. But our workforce right now, I would say as a whole for the university is about 30 to 40% on campus, and still 60 to 70% working remotely, or some iteration of that during the week, on and off campus.
All right, thank you. A question from Denise. What do you anticipate the spring semester to look like?
Vacation. I think that the spring semester is going to be we've learned a lot of lessons. I think testing is going to be mandatory. Again, I think the only reason we're still open is that we can test and prove that people are not sick. And we have good mechanisms in place to keep people isolated. I think that, honestly, as a society, I think people are going stir crazy. I think people there's a lot of parents who don't want their kids living with them anymore, so they want to send them back to college.
Right.
There's a lot of kids who don't want to be with their parents. I think it's going to depend on the economy. It's going to depend on so many different things. But I do think testing, we're going to do a hybrid probably for sure, in person and online. But it's going to depend on some things, I think. If they get a vaccine, I didn't even talk about the vaccination process and what we've been doing to think about that, but will people even do the vaccine? Will it make a difference? There's people telling me, even emergency responders, nurses, they're like, I'm not getting that vaccine. This is crazy. And others who are like, sign me up, I want to get the vaccine.
Right.
So I think it's going to depend on a lot of things. So.
Yeah, and how, sports are coming back, right? I'm not sure if you guys are playing football this fall or basketball this fall, but how does that change the dynamics on campus when sporting teams start practicing and playing again?
We have been doing the testing for our athletics team. They have very rigorous testing that they have to go through. We were hoping that the Pac-12 would allow some fans to come back, but they're not going to until January now. At least that's the latest news. You're not even allowed to go on the field unless you've had a negative test result. So, like, the entire team, everybody involved, all the coaches, every single one of them have to be tested. From a university point of view, you're absolutely right. Sports are huge. You know, they're a reason people like to go to games and socialize and, you know, drink beer if you do that and whatever. But it is this has been like a sobering year. Like, everybody's just been, you know, just tired. You know, we're tired of just not being able to live our lives, and I think people are just ready. So I think sporting events, you can't do musical events. I will say we have implemented procedures where I've seen kids outside in very large circles where 30 students are together, but they're all 6 feet apart, and they're singing. They've got keyboards out, and people are playing. Like, I think people are trying to find really innovative ways to still connect in society, but sports are definitely an issue that's going to take a little time.
Absolutely. Well, thank you so much. Let me just check to make sure.
There's two more questions.
Okay.
One you missed, which was, which saliva test do you guys use?
Yep. So we use you can get from Thermo Fisher Scientific. It tests for free. If you specific, you can send it later.
And then the other question was, how do you address the liability issues doing the testing internally, specifically with the high false positives with some of the testing?
Yeah, actually, so I didn't even tell you about our tests. So we've actually found that they're like 99.5% accurate. We have very few false positives. From a liability perspective, we are doing this all under an EUA agreement with the FDA. So there's restrictions on how you do the testing. We can't offer this at our university to the public, but we do have a public-facing site that was negotiated with our Arizona Department of Administration. The liability, we have everyone complete a waiver. We have a waiver before you can get tested. So as part of the scheduling process, you virtually put a waiver. We really haven't had many. People just want to get tested. They just want to, like, if there's those that want to get tested and they want to know, and then there's that don't want to get tested and don't want to know. Mm-hmm. From the randomized testing, though, I'll tell you, it's policy now, implemented policy. So you randomized testing, you have to take it. So I would say it's through liability protections and things like that.
All right, thank you. Probably the most important question, though, is your birthday celebration going to be rescheduled?
Oh, my God. I really want to go to, that map, the globe. I love South America. I mean, I love traveling, period. But I really want to go back to South America. But looking at that map, I'm like, I don't think that's going to happen anytime soon.
Yeah. Well, hopefully you get some time off and you get to celebrate your birthday. Thank you so much, David, for joining us this morning. Appreciate your time. And kick it back over to Denise.